Good morning, everyone. My name is Padmini Dilrukshi Ranasinghe, and I live in Maryland, USA. So my time is 11 p.m. So I'm excited and privileged to be here today to introduce our second lecture of series of climate and health lectures by Shri. So before we get started, I just want to let you all know I graduated from Colombo Medical Faculty and I completed my residency in internal medicine and preventive medicine with a master's in public health at Yale. And I'm interested in this topic in addition to multiple other public health topics, and also did some mental health related to disasters in Sri Lanka. So today I'm extremely privileged that the topic we are going to talk about is climate, health, disaster, and related topic. And especially, as you may know, on the West Coast, I live in the East Coast, there's a wildfire and significant destruction, and then lives were lost. So this is an important topic. So before this, the first few slides are from one of your consultants, Dr. Sumal Nandasena. So this is about Sri Lankan statistics. So, as what we have found is in Sri Lanka also there's a significant impact from the climate change. As you could see in this first slide, there's an average temperature rise from 1951 to 2023. I mean, it's a slow rise, but it's a significant rise. And then if you look at the number of days with heat index above 35 centigrade, it's also relatively increasing. There's a variability, but there's an increase. So those are definitely affecting not only the heat wave and heat related other aspect of your life too. And then if you think about the precipitation and how it's also changing, you could see from 1950 to 2020, there's a variability, but there's an increased trend. And then, as you may know, in Sri Lanka, floods have become very common. And then it seems like from 2010 to 2022, there's 7 million people were affected by that. And with the 400 deaths, this is after the tsunami. So as you could see, some areas are more vulnerable than the other areas, but it's still relatively, it's affecting majority of Sri Lankans. And then droughts are also quite common, and it's again affected from about 9 million people in these regions that's shown in this Sri Lankan map. And some areas are more than the others. And I think in Kurunegala and other areas, there are people who are like farmers. They have been affected more. And this leads to even mental health and other challenges when it comes to us for doctors. And landslides are another common thing happening in Sri Lanka, as you could see. I think there are a lot of areas. There's a small landslides to a large scale landslides affecting financial aspect as well as like more health. And then it's a huge economic loss. And cyclones is also coming to Sri Lanka, as you could see, some areas more than the others. And this is the most important slide. If you can look at and remember at least some of them. And one of the important statistics is when you look at the other countries, Sri Lanka ranked 104 out of 185, higher mean greater vulnerability. So Sri Lanka is having a high rate of vulnerability when it comes to climate and change in relation to disasters. And then yet the adaptation and preparation is not great. And it costs not necessarily lives, but it's also expensive to deal with that. And next slide series, I'm going to introduce our speaker. So he's from the US, so I know him well. So I'm going to introduce him and then we'll go. Then I'll hand over to him. Dr. Ankush Bansal. He is a MD, FSCP, and FSCPM, in addition to some other degrees he has. He did his undergraduate at Virginia Commonwealth University and then MD degree from Creighton University in Nebraska, and he did his internal medicine training in Delaware. And he also did an MPH at Yale. He's quite active with organized medicine and advocacy. That's how I know him very well, through American Medical Association and other organized medicine involvement. He was a president of Florida chapter in American College of Physicians, and then also he founded with some another physician clinicians for climate action, and then vice president for Florida chapter, that's for physicians for social responsibility. And he's also serving as the vice chair for American College of Preventive Medicine Advocacy Committee. So American Medical Association, as you know, this is the largest physician organization in the world. I'm also serving on the Council on Science and Public Health as a vice chair. So he's a member of that council. And then also for American Medical Association, he's representing Florida Medical Association. What is important to mention here is he's very active in climate and health group in the world. There's a working group called Environment Work Group in the World Medical Association. It has representation from all the countries. So he's actually representing US in one of the work groups. And additionally, he's a delegation, a co-chair to climate group that was established by the UN. And I know personally he's quite interested in lifestyle medicine, and he does a vegan diet or plant-based diet, and he likes to travel. So that's just a brief introduction on him, and then let's move into the presentation. So if you do have any questions, please email Sri. Because of this time difference, we may not be able to get to a lot of questions, so it might be better. But I'll tell you that some of the questions came through before this. Before we starting the meeting were related to healthcare resilience and how the Sri Lankan preparation. I think that's a good topic to discuss. I would say healthcare resilience or the preparation would be possibly the next topic, that series of this talk. So hoping we can touch upon Sri Lankan preparation as well from somebody from Sri Lanka. So thank you very much. And I'm going to give to our staff at the Sri to continue with the presentation. Thank you very much and good luck.
Good morning. My name's Ankush Bansal. I'm an internal medicine physician in Florida in the United States. I'm going to be presenting the effects of climate change on disasters and how we as physicians and public health experts can respond and help people affected by disasters caused by climate. So why am I talking about climate disasters, and why is it so important now? Well, as all of you have experienced, as I've experienced, as people all over the world have experienced, the number of climate disasters is increasing in frequency. This graph shows that among the major categories by this research company, meteorological, hydrological, and climatological, all of those have increased over the last 40 years. And they continue to increase. It is not getting better. So I'm going to break up the type of climate disasters into 6 categories: floods, storms, droughts, fires, extreme temperatures, and landslides. Floods. Those are the most frequent natural disaster over the entire world. It impacts every state in the United States and almost every country. These floods are becoming more frequent and more intense because of from heavier precipitation and rising sea levels. Storms. They can be hurricanes, cyclones, typhoons, very similar to each other, but they're also becoming more frequent and more severe due to higher temperatures and higher atmospheric water vapor. Next is droughts. These are long periods of low precipitation, and the reason this is important from our perspective in health is because it leads to water shortages for people, for animals, and for plants, and that directly affects food production and the nutrition of the food that we grow. Fires, as all of you are aware, there have been fires of more severity and of larger area over the last several years. We remember a few years ago in Australia and very, very recently in Los Angeles in California. There were up to 5 fires at one time. They have destroyed towns and villages throughout the Los Angeles area, killed several people, but have displaced so many people. These fires are increasing in frequency. As I said, they're involving larger areas, multiple fires as we've seen, and they are often human caused, but if they're not human caused, the most common natural cause of those is lightning. And if you go back to the previous slide about storms, we're getting more severe storms and more powerful storms, which often will include lightning. So that can lead towards fires in other areas. Next is extreme temperatures. We often talk about the extreme heat, and that is definitely a concern. If you remember my previous presentation, I talked about the types of heat illness, going from heat cramps to exhaustion to stroke, with heat exhaustion and particularly heat stroke being particularly important, where you do not get any sweating in heat stroke, but heat stroke means that your body cannot adapt or respond to the excess heat, and so you will start getting organ and system shutdown. But we also don't talk that much about cold spells, and these are also becoming more frequent as more areas of the world are seeing colder temperatures in the winter because of the pushing of the polar air masses further south into more populated areas. The issue with cold spells is it's more difficult for people to adapt to them and to protect themselves from it. If you don't have heaters, if you don't have blankets, if you don't have shelter, you can't really protect yourself from cold spells. For heat waves, sometimes you can take shelter under bridges, for example, or under or inside vacant buildings to protect yourself from heat, although that's not always effective. But cold spells arguably can cause more deaths than heat waves. The next is landslides, which is basically just mass movement of layers of the earth. For example, soil and the under layers of soil as well. This is usually triggered by heavy rainfall, again, going back to storms. The thing with landslides is it's becoming more frequent in number. The size of these landslides are increasing, and the speed at which these landslides move is also increasing. Now let's talk about the broad health effects. So I've broken these up into 7 categories here: injuries/fatalities, heat illness, respiratory issues, infectious disease, waterborne illness, food safety, and mental health. And I'll talk a lot more about mental health at the end of the presentation also. So injuries and fatalities, this is fairly self-explanatory. It often occurs due to hurricanes and floods and wildfires. It includes emergency access to victims. So if there's, for example, a hurricane or wildfire, it's harder to access victims by emergency medical personnel, by government, by other relief organizations. And this also becomes exacerbated by effects on the healthcare system. So if these severe climate emergencies happen to populated areas, they're probably affecting the healthcare system as well. And so you have decreased access to the healthcare system, decreased capabilities of the healthcare system. Physicians and nurses may themselves be affected, and so they can't respond to victims. And so this just plays into increasing injuries and fatalities. Heat illness, again, heat exhaustion and stroke is the most famous and the most severe. But you also get dehydration, and I've seen this where I live on extreme hot days in the summer, where people who have no prior medical history, they do not use illicit substances. They do not heavily use alcohol. They are not on any prescription medications, and they become dehydrated from either working outside or being in an area that does not have proper access to water or cooling. And so these people then come in with either cardiac, pulmonary, or renal conditions, or their pre-existing cardiac, pulmonary, or renal conditions become exacerbated. So for example, somebody who has a history of congestive heart failure, because it is so hot, it is causing increased stress on the heart, and it may cause them to drink more water than they should, especially if they are on diuretic therapy, and this may lead towards an exacerbation of their CHF. For those patients that have asthma or COPD, when it is extremely hot, it is often accompanied by increasing air pollution, and so it can exacerbate their asthma and or their COPD. And then for those patients that have chronic kidney disease or those who are at end-stage renal disease, especially those that are on dialysis, whether peritoneal or hemodialysis, the heat illness may exacerbate those conditions to the point where they need to be admitted to the hospital for emergency care. Elderly are most vulnerable, as we've all seen. Elderly often have poor thirst drives, and so they don't drink enough water to begin with, and so they are more affected by heat illness. Their response time is decreased just neurologically, or they may have cognitive impairment, if not full dementia. And then also young children are affected because they do not know how to respond to changes in their body or symptoms that they have. They may have medical conditions, but I think it's more that they are dependent on their parents or other adults, and they do not know how to respond to heat illness. The respiratory effects, as I had mentioned before, it's worsened by wildfires, by dust storms, by excess heat. Often all of those will lead towards increased air pollution, including PM 2.5. So you get worse air quality, exacerbating asthma and COPD, cardiovascular disease and heart failure, and then chronic kidney disease or end-stage renal disease. The other group to consider are cancer patients, especially those that may be on chemotherapy or have been receiving, let's say, chest or neck irradiation. They may be more affected because they already have some respiratory conditions related to the cancer, or because they are anemic or have other pancytopenia, so that also affects them as well. And then any kind of immunocompromised patient. So these could be rheumatologic conditions, these could be infectious conditions such as HIV or tuberculosis. This, of course, could be cancer patients, and then any other patients who may be immunocompromised. Infectious diseases, we are altering where insects normally have their habitats. This is due to changes in temperature and precipitation. So mosquito-borne illnesses in the northern hemisphere are moving further north and to higher elevations because of increased temperature and because of changes in precipitation patterns. Similar things are happening in the southern hemisphere. And so populations who had no prior exposure or experience to certain vector-borne illnesses, such as Zika, such as chikungunya, such as dengue, they are all being affected. Many times in the natural habitats, these insects have natural predators or other species that keep these insects in check. They are not often present in these new regions of the world where these insects are migrating due to temperature and precipitation changes. So that causes an explosion of these insects and of these diseases. Waterborne illnesses, often is from contaminated water supplies from floods. So this includes things like cholera and dysentery. But these then will lead towards malnutrition, and in children, this can lead towards growth stunting, which is especially um, sad because even after the disaster has passed, these children may have lifelong effects from this because of the malnutrition during their childhood when they're still growing and developing. Food safety, food production can be affected by most of these disasters, whether it is floods, wildfires, hurricanes. We've seen that in many parts of the world where food production can be temporarily affected, but other times where food no longer grows in some areas, or the quality of that food because of the change in the soil, the temperature, the water vapor, the precipitation has changed, the humidity. This can lead towards food shortages, again leading towards malnutrition. And then, of course, shortly after a disaster, and then if there is a long recovery period, if you don't have access to food, of course, it's going to lead many people, probably most people, towards desperation, which can lead to crime and looting, especially if you have a family to feed, and especially if you have children or vulnerable adults, such as elderly or those with chronic illnesses. Um, but this food production being affected also increases the risk of foodborne illness because now you have a smaller area in which to grow food. There is a rush to get food, so the localities and the businesses are trying to increase production, and so this can increase the risk of foodborne illness. Mental health, I'll just briefly talk about it here. As I said, I'll talk about it more at the end of the presentation. Um, there is stress and trauma from the experience of the disaster. Um, there could be ongoing stress from the disaster recovery. There have already been studies that have shown that disasters, especially the more severe they are and the more it affects the local populations or individuals or families, can lead towards increased rates of post-traumatic stress disorder, anxiety, especially depression, and other mood disorders. It leads towards decreased work and life satisfaction, which then affects the society economically, as well as the community as a whole. And so then family and civic life are affected, and this can then affect children as well. And so this can create a cycle of either abuse or dependence or inadequate coping mechanisms. And so this has long-term effects. So what are the population effects? Displacement, health impacts, and vulnerable populations. So displacement means that it's forced migration, in this case due to climate-related disasters. This can be internal and cross-border displacement. So internal means migrations within the country. Cross-border means across national boundaries. In 2022, the global estimate just from climate-related disasters was that there were 32.6 million internal displacements. That is a significant number of displacements from one category of disasters just in 1 year. Most of these internal displacements, again, because these are the most common climate disasters, were floods, storms, fires, and droughts. So what are the health impacts? You have poor health among those displaced people because now they do not have a home, a community. They do not know where to go for services, whether it is for food, for work, for health. And they may not have money. And so they have poor health because they're basically just trying to survive. There's increased rates of communicable disease because often with displacements, whether internal or cross-border, you are compacting the number of people into a smaller area. Again, they are temporarily nomadic, and so there's not adequate sanitation, shelter, um, amount and quality of food, and then of course medical care, so that increases the rate of communicable disease, but it also increases the development or exacerbation of non-communicable diseases, such as cardiovascular disease, pulmonary disease, and renal disease. So who are the most vulnerable populations? I briefly mentioned this earlier. It's children, elderly, but it is also those people that are low income, who may not have stable housing, stable jobs, stable access to medical care. Are those people that are either that are unhoused, which means either they are homeless, living on the street, or those people that are going from shelter to shelter. So, for example, from a family member's house to a friend's house to a colleague's house. And then women, for a large part of the world, are also vulnerable, and that's due to a variety of reasons, including cultural limits on their political and work participation, medical care as well, and then often in many societies, the women are responsible for taking care of the children, and so they are already now taking care of another vulnerable population, and so they themselves become vulnerable as well. What are the economic effects? And this is just very, very brief and very high level. There are, of course, economic losses. It affects jobs, business, and productivity, and then also affects the insurance and financial markets. So economic losses. From 2010 to 2019, the global estimate is that climate-related disasters cost 1.5 trillion US dollars in those 10 years globally. Economic losses also lead to property damage, infrastructure damage. So, for example, roads and bridges, transportation hubs such as airports or train stations. It can also include things like fire stations, police stations, schools. It affects losses to agriculture, forestry, and fisheries. So then this affects our food supply, as I had mentioned earlier, but also raw materials for things like building, houses and businesses. And then in those areas that are dependent on tourism, there is a direct loss to tourism, understandably, if a place has just had a significant disaster and they are still in the recovery phase. In jobs, businesses, and productivity, this most affects low and middle income countries, just because of the um, decreased availability and variety of jobs. In some areas of the world, there may be only one or two sectors of commerce. And so if those commercial sectors are now damaged or destroyed by a climate disaster, now there is no business, there's no jobs for those people that have survived the climate disaster. In those same countries, the low and middle income countries, these losses can affect a significant percentage of that country's gross domestic product. And so this can have long-term effects, even in parts of the country that were not affected by the climate disaster. So if the climate disaster, let's say, was in the southeast of the country, the northwest of the country may be affected just because the entire national economy has been negatively damaged by the climate disaster. Again, loss of jobs. And then if you have decreased GDP, loss of jobs, lack of businesses or inability to restart businesses, this will lead towards reduced economic productivity. For insurance and financial markets, um, those parts of the world, especially those local areas that are seeing more frequent climate disasters, may be turned away by insurance companies to insure those properties for casualty insurance and so then it becomes unaffordable to either have a residence there, to open a business there, just because they cannot afford the insurance premiums if another disaster or other calamity may happen. This has been happening a lot in the United States, particularly in Florida and in California, where there are many places in those states where it is extremely expensive or just impossible to insure the building because of such frequent and severe climate disasters. Again, there can be refusal of insurance coverage, and then because the insurance companies are negatively affected by increased number of claims and the degree of how much they have to pay out in claims, and because insurance companies often are investing in the broader financial markets as part of their solvency, this can have negative effects on those financial investments as well. So what are the frequencies of climate disasters? Well, in the last 50 years globally, the number of climate disasters have increased 500%. From 1970 to 2019, climate disasters accounted for 50% of all disasters that affected communities. 45% of all reported deaths from disasters were from climate-related disasters. 74% of all economic losses in disasters were from climate disasters. There were 11,000 recorded disasters, probably more, in the last 50 years, 2 million deaths, and this cost a total of 3.64 trillion US dollars in losses. So let's talk about the distribution of climate disasters. 91% of the deaths are in developing nations, so the low and low middle income countries. The economic losses from the 1970s to the 2010s has increased 700%, and storms cause the largest economic losses globally. So these are hurricanes, typhoons, and cyclones. And this is something that I remember happened about 20 years ago in Sri Lanka, has happened many times in my home state of Florida, has recently happened in Spain when they had their severe flooding and storms in November, December of last year. So this affects all parts of the world. So how do we respond to climate disasters? What can we do as public health experts and as physicians who are also advocates for their patients and their communities? So the domains that are often quoted are mitigation, adaptation, resilience, and recovery. So mitigation, there's three main things to take away for this is number one, reduce greenhouse gas emissions. Number two, promote renewable clean energy. And number three, enhance energy efficiency. So what do these mean? So reducing greenhouse gas emissions. There's many ways to do this, but these three are the most commonly talked about in the last year or two. Number one is carbon pricing, such as carbon taxes. Number two is changing the transportation system, and this can include more electric vehicles, increasing the amount and the distribution and the access to public transport, whether that is by bus or train, encouraging cycling, and making more walkable parts of cities and suburbs. Industrial, that would involve clean technology, alternative fuels, such as electric, such as hybrid engines, And then energy efficiency. Promoting clean renewable energy. Um, the most commonly talked about are solar and wind because this is available and possible in many parts of the world. And this would include both at the residential level, so having solar panels on your house or on your residential building, but also large scale solar and wind farms that may power a city or a village. The next one would be hydropower and geothermal. This is more limited to those areas that have this capability, for example, near a major water source that has a lot of kinetic energy that can give hydropower, or those that have geothermal energy that is accessible. And then the third way to promote clean renewable energy is policy incentives. So many countries have tried different ways to encourage clean renewable energy. These have included things like subsidies, tax credits, grants, specialized access to parts of the city, for example, roadways. Um, uh, so a lot of different incentives can be used. The next topic is enhancing energy efficiency. And these include things such as building standards for energy efficiency. So what that means is if a new, let's say, commercial or residential building is being built, or if a existing building is being retrofitted or significantly renovated, to incorporate energy efficiency principles. So that may include better building materials, insulation, better windows that improve energy efficiency. Same thing with doors, ventilation, natural light, natural ventilation also. It depends on the region of the world, but also what is available in that area. Another way to enhance energy efficiency is appliance efficiency. So this does not just mean things like refrigerators or stoves, but this also may include electronics as well. And then the last one is retrofitting existing buildings, as I had mentioned before. This is things like insulation and windows. Adaptation would be the next domain, and this includes public health, urban planning, and community education. So public health interventions. If you remember my last talk, I talked a little bit about heat action plans. That is very important in those parts of the world that are prone to excess heat. So those would be those that are further south in the northern hemisphere, further north in the northern hemisphere. But it may also include other areas too, depending on the local climate. Other public health interventions is water distribution. So if there is a drought or there is fire, how do you distribute that water? This is something that Los Angeles is faced very recently with their multiple fires, that they had enough water for normal use, but because there were so many fires, they were limited in how much water they could use. In fact, in some places the water ran dry. And it was not because of poor planning in normal situations, but what do you do in emergency situations? How do you get water to fight wildfires? Or if the water supply is affected, how do you get clean water to the population until the infrastructure can be rebuilt? There's education on heat illness, as well as other climate disasters. So what do you do when there is mosquito season, or when there is a local health authority alert on a infectious disease outbreak? Vector control programs. So how does the community or the city or the country deal with new infectious diseases like dengue or malaria or Zika? Do they eradicate the mosquitoes? Do they do more education of the community to not have, for example, standing water outside? These are all vector control mechanism programs, mosquito control, and then vaccination programs. Those are important where vaccinations are available. And this also includes treatments. Also, how do you get medication treatment for those that are affected by infectious disease? How do you get treatment out to those that may be suffering from waterborne illness? How do you get treatment out to those that are affected by excess heat? Urban planning. This is this is definitely a very important part of adaptation, because if you live through one disaster, that doesn't mean that the next disaster will be just as will be the same. It may be worse, it may be less severe, but there needs to be some effort and some mechanism for that community or that city to plan for future disasters. And this includes things like green infrastructure. So what this means is more walkability, more bicycle lanes, more public transport, um, more parks, more fresh air, clean air, not having waste facilities or incinerators near major populated areas. Parks, green roofs, urban forests, again for clean air, but also for heat protection. And then in the case of hurricanes, these parks and these forests also work as a buffer against heavy winds, heavy rains, flooding. Reduce the heat island effects. So that means less concrete, less asphalt, more parks, less vehicles on the road, managing stormwater. Again, more natural areas that can absorb that stormwater. This is what swamps and marshes do naturally when they're near waterways, is that they manage that water so that the area more inland is not flooded. Hurricane-resistant buildings, just like we have in earthquake-prone areas, earthquake-resistant buildings, we need to build hurricane-resistant buildings as much as possible according to what the technology of the day allows. Just as a side note, you may have heard that there is a scale for hurricanes, at least in North America, from category 1 to 5. Well, the two scientists who created that scale, they have been asked many times why there is not a category 6 hurricane on that scale, even though we have already seen hurricanes that are very, very close to being a theoretical category 6. And what they said is our technology, our engineering know-how, we don't know how to build to resist a category 6 hurricane. And we've already faced category 5 hurricanes near Japan. Sri Lanka was, I think, a category 3 or 4. In Florida, we've had category 4 and 5 hurricanes. Same thing in Texas, in other parts, in Philippines also. But if we can build that can resist, let's say, category 5 hurricanes, at least category 4 hurricanes, we reduce the destruction, the effect on health of individuals and communities, and then the mental health as well. For those areas that are flood prone, instead of building on the ground, build elevated homes. So for example, in some parts of the world, so let's say the Netherlands, in some parts of Florida and Texas, they will have homes built on stilts, or there will be pillars where the home is actually elevated above the soil, above the land, so that if there is a flood, unless it is a major flood or a tsunami, the water will flow under the house and the pylons or the columns are strong enough to withstand that force so it doesn't destroy the home. Community education, this includes education on what climate risks are, how to modify behavior to reduce the vulnerability. So that could be for heat illness, that could be for air pollution, for those with chronic disease. How do they evaluate the forecasts and how to protect themselves? as much as possible from excess heat or from air pollution. Disaster preparedness. So the community education there is if you live in an area that is more prone to hurricanes, how do you prepare for that when the hurricane season is approaching? Or for those that are more prone to fire or floods, how do you prepare for that? What is your escape plan? How do you make sure you have enough food and medicine? Who do you contact in terms of family or friends to escape to or to notify that you are safe? Other community education is energy conservation, um, which then reduces the need for electricity, which then reduces the need for fossil fuels, which then reduces greenhouse gas emissions. And then local leader engagement. And by this, I mean politicians, the policymakers, but also community leaders. So this could be a respected leader who is not an elected position, but who many people follow for any number of reasons. Educate them so that they can then educate and or protect or advocate for their community individuals. The next domain is resilience. And resilience means how do you make sure that when a disaster hits, that you are ready, and that as few people are negatively affected and as few fatalities occur because of that disaster. So I'm going to talk about three things in resilience. There are many more. One is build climate resilient health systems. The next is early warning systems. And the next is community engagement. So on building climate resilient health systems, what this means is um, building health systems, so that is hospitals, clinics, um, long-term homes for those that are chronically ill, in a way that they can withstand extreme weather. This is similar to what I talked about previously about building fortification for businesses and residences, but this is specifically for the health systems, so that they are still standing. Everything else in the community may be destroyed, but the health system is still there so that they can serve the victims medically, for their needs, as well as mentally, and also to serve as a place for social gathering so that people can get updates and can find missing family or friends. The other part of building climate resilient health systems is supply chain management. This is actually being done among several countries, particularly in the global north, and this is for essential medicines and equipment. So what this means is when the disaster hits, how does that hospital make sure that they can continue to get medicines, IV fluids, devices that they may need, so that they can provide that medical care in now that fortified building, even though the normal supply chain routes are damaged or affected. Early warning systems, just like it sounds, this is as soon as you're able to notify the individuals in a community that a disaster is coming, how severe it is, where it is going to affect people, and how to respond during and after the disaster. So there have been studies that have shown that such systems have reduced deaths from 50,000 per disaster in the 1970s to under 20,000 in the 2010s. These include monitoring technologies for timely alerts, but I think more important is robust communications networks. So what happens and what we've seen in different parts of the world during disasters is that the government or the community emergency response centers are trying to get information out to the inhabitants, but they can't because the mobile network is down, or the internet is down, or phone systems are down. So what this means is how do you build a communications network that has safeguards, fallbacks, redundancy, so that if the normal communications networks goes down, you can still reach people even if you only have one system left that works. So you may only have phone systems up or only mobile towers that are left. But do you have some kind of communication network that can reach as many people as possible? And then the last domain is recovery. And this is emergency response plans, mental health support, and rebuilding infrastructure, but in a climate friendly and resilient way. So the emergency response plans, these require coordination. And this is coordination not just among the government, the local and the national government, but also those agencies in the government that are responsible for emergency response, NGOs, and then community local groups. And the reason this is important is because the government can only do so much according to what their laws allow. The NGOs are trying to collate and provide relief for organizations, but also to collect funds to be able to provide that relief. But a lot of the work is often done by the local groups because they're already on the ground. They know the community, they know what the capabilities are, they know what the needs are. So I think the community local groups are the most important, but they're also often under-resourced, which is why they need the NGOs, and they also don't have all the information, which is why they need the emergency response agencies and those government agencies. The other part of emergency response plans is pre-positioning of supplies and equipment. So, for example, in the United States, there are things called strategic national stockpiles, SNS. And these are various parts in the country where there are things like medical supplies, medical devices, food, water, that are available in the event of a disaster, whether it is a climate disaster, whether it is war, whether it is something else. These are pre-positioned supplies and equipment that are available in large cities and probably other areas. At least in the United States, most people don't know where it is because it is a national security secret for obvious reasons. But even in other countries, even if people know about it, just having that available, I think, provides some relief for people that they know that their government and their communities are ready to provide supplies, food, medicine, if there should be a severe disaster and everything else is destroyed or damaged. But the other part of that is it kind of forces people to practice and prepare for these disasters so that they can fine tune it each iteration for when the actual disaster does occur. Mental health support includes both counseling services and then support groups after and sometimes years after the disaster. And for counseling services, many times people talk about the victims, which is definitely necessary, but I think it is also equally important to think about the emergency and the relief workers. So this is physicians, nurses, those emergency responders in the field, those people finding people in rubble or in collapsed buildings, those people providing food for victims before they're taken to the hospital or relocated. I think all of these people need counseling services as well because this is a very traumatic experience. Some of you may have already faced this in prior disasters, so you will understand what I'm saying here. And then the last one is rebuilding infrastructure, but better. And I kind of talked about this already. This is improving resilience to future climate impacts, but also financial aid and insurance for people and businesses so that they can rebuild and return back to normalcy as quickly as possible. So now I'm going to talk a little bit more about the mental health aspects. And the reason I'm going to focus the rest of the time on this is because we talk a lot about the physical effects of disasters, but we often forget about the mental effects of these disasters. So this first graph is from a researcher that was published in 2004 about four different theories of how mental functioning is disrupted in people by disasters. And you can see that, if it's chronic, it may start as severe, but it doesn't really get better even 2 years out if somebody has a chronic disruption. If it's a delayed disruption, it may start out, let's say, mild to moderate, but then it gets worse over time, again, because they're not getting the services or the support that they need. Recovery is where people start out very high, but they get a lot of support, and so they fairly quickly over 2 years recover down to mild disruption. And then resilience is ideal because resilience here means that you weren't expecting this, nobody can be prepared for this, but you had already a plan in place, so it did not create a severe disruption when the disaster hit. And you also don't have a delayed response, but you also don't develop a chronic dysfunction. You kind of stay at a 0 to mild level of disruption. I'm going to show you two studies here, and these are both meta reviews over a 20-year period. This first one is from 1981 to 2001, and they looked at disasters all over the world, talked to 60,000 disaster victims. This study was published in 2002. These victims were from 29 countries, 160 disasters. And you can see here printed that 11% of the survivors had minimal psychiatric impairment. So that's that resilience graph that I showed before. But 51% had moderate and 21% had severe impairment. Even very severe impairment was 18%. So this is a significant problem because, again, we talk about the physical effects of climate-related disasters, but we're ignoring the mental effects, and these last much longer. And so you can see here that they're saying that the impairment was based on PTSD, major depression, generalized anxiety disorder, or other symptoms. And children and teens actually had higher rates of impairment. And I think there's several reasons for this. Number one, again, they're dependent on adults. But the other thing is, children and teens, they're still growing and developing, especially their brain. They have not developed proper coping mechanisms for disasters or anything that is a significant effect on the way they view the world or the way they think the world should be. So I think that's why they have significantly higher rates of impairment. This one was for the next 20 years. So this went from 2000 to about 2020. And this looked at 29 countries. And you can see here that post-traumatic stress disorder, it had a pretty high prevalence, but it continued over time. Even though there was some improvement, there was still significant post-traumatic stress. I'll skip over to anxiety. Anxiety also remained for many years, but anxiety actually improved, as did post-traumatic stress when you compare it to the control. The main one to worry about is depression, because if you look at the rates of depression over 2 years after a disaster compared to the control, depression remained high. It actually didn't significantly improve. And again, it was worse for children and adolescents. So then the question is, well, what if you did subgroup analyses? Does it matter based on demographics? Like, are younger people affected more than older people? Are certain races affected? Is it based on socioeconomic status? Are men affected more than women? Does it matter if you have children or not, or if you have stable housing? And you can see the graphs here that yes, there is some difference by age, but the trends are the same. It's just that kids are affected more severely, but it's not like they are that they get worse or that they improve at a different rate than other age groups. It's pretty much the same. Same thing with race and ethnicity. And this was done in the United States. So they're looking at Black Americans versus other races. Household income, it really didn't make any difference whether you were on the um, poor side of the socioeconomic status or more affluent. Males and females made no difference. It really didn't make much difference whether you had a child or not. And surprisingly, it didn't make much difference if you had stable housing or not. So this is a very busy graph. I'm not going to go over all of this, but this just shows that, the adaptive capacities to disasters from the physical health, mental health, and public health standpoint are quite complicated. And they all lead to something called social capital. But that's where you provide that resilience and that recovery. So the last thing I'll talk about is a term called solastalgia. So this is a term that's used to describe the distress people feel when their home environment changes in a way that negatively impacts their quality of life, usually by a disaster. So solastalgia, it's a combination of the words solace and nostalgia. So solastalgia can cause people to feel sadness, fear, and helplessness, can challenge people's sense of place and identity, and it can impact a person's traditions and daily habits. So basically, the solastalgia can change the way you think, the way you interact with other people, the way that you view the world. So this is a long-term effect from disasters, and in this case, climate disasters. So this was a study that was published in 2015 talking about solastalgia and psychological distress after wildfires. And so what they're saying here, and you can see part of the solastalgia scale. I didn't put the entire scale because it's quite long, but basically what they're saying here is that when your landscape changes where you live, so let's say you have a flood and all of the trees are gone, all of the farmland is gone, or if there's a wildfire and everything you see is burned, or if there's a hurricane or a typhoon and your entire community and everything that you know that you grew up with, that you've been living amongst for a long time is destroyed, it reduces your your feeling of solace, leading towards solastalgia. You're wishing for that back, and the reason that's important is because you see this scale. A 1 point increase in that scale was associated with a 26% increase in mental health distress. So this is why I mentioned this. That when your environment changes so significantly and so quickly from a climate-related disaster, it can lead towards significant risk of mental health problems in the future. So what are the lessons on disaster resilience? I've listed them here: attachment, you need agency, self-efficacy, mastery, motivation, you need intelligence, that's both regular intelligence, but emotional intelligence, regulatory systems for controlling arousal, affect, attention, and action. You need family, peers, support from school or work, community systems and collective efficacy, and then at the larger level, at the macro level, change in culture, media, and then the national, international institutions to actually mitigate, adapt, provide resiliency, and then recover from these climate caused disasters. And these are some of the disasters that happened in the United States just last year in 2024. So this first picture here is Hurricane Helene, which occurred in Florida on the other side of the state where I lived, but there was a hurricane called Milton, 2 hurricanes after, also in 2024, which where I live, there were some effects. Luckily, no destruction in my immediate area, but there were houses within a few miles of me that were destroyed because of tornadoes caused by the hurricane. Here you see another hurricane which affected Texas and how it created these floods. This is a major highway, actually two highways, and it's completely flooded. This car cannot go anywhere. And then this bottom picture is the recent wildfires in Los Angeles. Everything is burned. The trees, the buildings, the cars. There's nothing to return home to. And these are the human impact of disasters. Again, I'm showing pictures only from the United States, but you can imagine this in any country in the world to some extent. What happens when there's a hurricane and now everything is flooded? Your only way to get around is walking in this water that is up to your waist. The same picture again of hurricane in Texas, the fires. Look at this entire city back in 2017. And I remember I used to travel through this city. This was all completely destroyed, burned. And then for those people that are older, who have illnesses or who cannot move well on their own, they are dependent on others, and now they are isolated because nobody can access them and they cannot get anywhere. So thank you so much, and I hope you found this presentation helpful.